Pemigatinib, we heard today, was FDA approved for patients with relapsed refractory myeloid or lymphoid neoplasms with eosinophilia. So this is, and of course I should say harboring an FGFR1 rearrangement. So this is a very interesting and difficult group of neoplasms. So as the name suggests, they can be myeloid or lymphoid. So right there you have a difficult presentation right at the outset. This is a FGFR1 rearrangement. Usually it involves 8p11 where the FGFR1 gene sits. That's where it resides, 8p11, chromosome 8p11. And then there are many partners with which it can be rearranged. So the most common partners, for example, are ZMYM2 and then BCR. These are your more common partners, and there are others. So you look for this rearrangement by FISH to identify the presence of an FGFR1 rearrangement. It's less important what the partner is because you're going to target the FGFR1. I think the biggest challenge is how to identify this or even think about it in the first place, because sometimes you may not have eosinophilia. So we are used to looking for this when there's eosinophilia, but you can get a good proportion of patients without eosinophilia. So I think this approval will hopefully spur additional awareness and efforts to think about this entity, this very rare but treatable entity. So Pemigatinib is an extremely effective drug. This is from Incyte. It's a small molecule inhibitor of the FGFR group of kinases. I think it hits FGFR1, 2, and 3. Whereas the target in question here is FGFR1, but the drug is already approved in cholangiocarcinoma, advanced cholangiocarcinoma, where I believe the target is FGFR2. I don't do any of that, but I think that's what the target is there. So here I think this is a major advance because there's really nothing much that could be done for these patients. You would give them standard chemotherapy, hope to get a remission and take them to transplant. Other than that, there was really nothing. Prognosis is pretty dismal for most of these patients, especially in blast phase. So what I'll say about the results is that the complete response rate was a staggering 78%. So it's a very high complete response rate. And so that just tells you that it hits the target really well. Now the only thing to note is that the results are a lot better if you are treating the patient in chronic phase. If they're already in blast phase, those results are more modest. They're not quite as high as 78%. But regardless, it's an enormous new advance, a very welcome new addition to what we can do for this very difficult disease.